As you know, PCORI, founded in 2010 by an act of Congress, to fund comparative clinical effectiveness research. Why is our work needed, though, to fund comparative clinical effectiveness research with a patient-centered lens? It's really that for all the advances that great research produces, it hasn't necessarily always answered patients' questions. People want to know how these different interventions are going to work for them. What's going to work best for them according to their preferences, according to their situation in life. That's what PCORI is here to try and help answer. We've heard from our friends in pre-market and helping to get things to market. PCORI occupies this space kind of in a post-market space, looking at once things have already made it into the market, how do we then assess and help folks make the decisions about what's going to get them to where they want to be. PCORI, what we fund, is a relatively new form of CER, considering patients' needs, preferences, and outcomes most important to them, looking at what works for whom under what circumstances. So patients, they inform us very closely. Clinicians inform us very closely. The PCORI life cycle, and I'm kind of rushing through this as well because I know that we want to leave some time for questions and answers here, and that's always one of my favorite times. So patient-centered CER, we engage patients and stakeholders, topic identification, research prioritization, conduct of the study and analysis of results and dissemination. So patient-centeredness and patient and stakeholder engagement, very important to us. And why engage? So to influence research, to be patient-centered, relevant, and useful. Establish that sense of trust and legitimacy in findings, and to encourage successful uptake of results. We have been working very hard on a lot of these different areas. So patient-centeredness and patient engagement, we have focused on like a laser from the beginning, from day one. Everything we do has been informed and driven by patients and other stakeholders. So this is at the core of what we do. How is it that we bring patients into this paradigm? Not only trying to identify and say and assume, like the old schoolyard taunt goes about when we assume that we know what patients want, how do we actually talk to them? And that's one of the reasons why I'm delighted that we've had Dave, why we've had AAKP with us throughout this whole journey of ours to make sure that we understand and incorporate what patients really want, what their preference is, like Sandeep is doing with Kidney X, trying to understand how it is that what we can do can be responsive to patients, how it is, as Dr. Starr is doing, how it is that what we're doing can be responsive to what patients prefer. It's been at the core of our being. And how do we maintain that? We maintain that through patient and stakeholder engagement, not only requiring it in the work that we fund, but requiring it of ourselves. So we have a range of different mechanisms that we use to do that, from our advisory panels that help us understand how it looks in practice and making sure that they're there to help us prioritize what we're going to fund, to helping us with reviewing applications when they come in, to making sure that they're part of the process of the research, to having them there with us as peer reviewers when we get our final research reports in. So all of these different mechanisms make sure that that patient voice, that stakeholder voice is there, so that way we have a nice, well-rounded, holistic, real-world view of what it is that that's coming through this research pipeline. Why engage? For all sorts of good reasons. But we heard when we started up, how is it that this should actually work? So we developed a rubric with patients to try and help provide some just good guidance on how this should work in practice, in the practice of research. And frankly, having a preschooler and a first grader, myself, gets back to a lot of the stuff that we're taught early on. It's about reciprocity in your relationships. It's about trust. It's about transparency. It's about working together, co-learning, being honest. And it's about using all of those principles throughout the planning of the study, the conduct of the study, and the dissemination of the findings. For us, I couldn't fit my original, nice rounded picture in here, so I've had to go with this new sunrise that I'll call it. And I think this actually works well for us because when we wake up in the morning at PCORI, patients are where the sun is rising for us. We don't let the sun get up over the horizon without thinking about what we're doing and how it can help out patients and how it can help out caregivers and family members of patients and clinicians and the advocacy organizations that serve them and so on. We make sure that we try and have all of these voices represented in our work. Our three major funding award styles that we have right now. Broad awards, we're going to continue to pump these out. Targeteds are for when we have very key directed questions that have risen to us from one or multiple stakeholder communities, and pragmatic studies. And I'm happy to talk more about these. As Paul mentioned, we've pushed out about $70 million for 17 studies in kidney disease, and I imagine he went quickly through a few of the case studies, which I'm perfectly happy to talk about more at the Q&A if you're interested. Patient-centered medical home for kidney disease, reducing health disparity in chronic kidney disease among the Zuni nation, comparing the benefits and harms of medicines for long-term treatment of blood clots. The alternative study, I was looking at Dr. Patel's earlier slide with the different acronyms and trying to think what sort of an acronym I can make out of that. After a career in public policy and legislative affairs and a career in research, boy howdy, acronyms are just always driving my family crazy about how we can take every single sentence that comes to us and condense it into a nice little mnemonic acronym. It's a real mental condition, and we might study it later. We've actually put a lot of money into developing something called PCORI, the Patient-Centered Outcomes Research Network. So what is one of the biggest challenges when you're going to conduct research? It's assembling your cohort. So this is a way that we can look at real-world situations. We have CDRNs, clinical data research networks, that bring together electronic data from clinical systems, so healthcare systems, electronic medical record data. We also have patient-powered research networks. So these are patient groups that have come together to try and harness their community's strength in data. And how can we marry those up through a common data model, similar to what Sentinel uses, to be able to develop a cohort more quickly, efficiently, and run research more effectively. We also understand that engagement in research is fairly new, so we've come up with research support opportunities called the Engagement Awards. Our upcoming cycle deadline is on October 1st. So any of our friends here that would be interested in submitting for the October 1st deadline know that you have about 48, 72 hours? Plenty of time. But we're going to continue to do these throughout the year. So these have been a very effective way for us to help communities understand how they can be engaged in PCOR, how they can understand PCOR, how they can disseminate PCOR. But it's not only what we've been doing, it's what we want to do in the future. So we are very excited about the stuff that we have coming down the pike. 2019 is going to be a huge year for us. So far in 2018, we've already pumped out about $215 million in new research obligations. So research under our 5 national priorities of assessment of prevention, diagnosis, and treatment options, improving healthcare systems, communication and dissemination research, addressing healthcare disparities, and improving the methods for conducting CER. We've also pushed out $9 million in obligations for dissemination, because it's not just enough to publish your findings and have them sit on the shelf. NEJM is wonderful. JAMA is wonderful. Those are the coin of the realm, but we can't just have it sit in a journal. We need to think about ways that we can all work together with our professional societies, with our patient organizations, to help with, patient engagement and patient research and education. How do we get these to work together and work holistically so that way information doesn't just sit there, that we're actually informing better practice? In June, we offered some targeted awards, as I mentioned earlier, for opioid use disorder interventions, also MAT for pregnant women with opioid use disorder, and advanced illness symptom management, all very important areas. We also are going to support up to $6.5 million to fund projects that can look at implementation, not just the dissemination, but the implementation of evidence into practice. We'll also push out more of our broad funding announcements in the coming year. And finally, one of the things that I'm very excited about is that we're stepping into systematic reviews. So we commissioned our first 4 systematic review updates with the Agency for Healthcare Research and Quality, all of which are delivering. And we're excited to be doing at least 1, if not 2 more rounds in the next few months that we will announce very shortly. So we've been looking to pull together topics that can inform particularly the update or development of new clinical guidelines. And one of the things we've also heard is, how is it that PCORI can be a more effective entity in the post-market space. So how do we look at things and how do we get a handle on things that are coming down the pike quickly? Because as innovation accelerates, as more targeted, precise treatments come to market, people want to understand these treatments. So we're going to establish a healthcare horizon scanning system. Previously, the Agency for Healthcare Research and Quality operated one. This is an initiative that we hope to start up soon. This will look at and monitor target technologies and therapeutics in healthcare. We're going to put our own PCORI twist on it, though, and of course, so that way, when these products hit the market, we can start to help folks understand, again, what can they reasonably expect will happen if they choose this intervention. So it's going to be a very important area. It also is going to serve us all in terms of helping us get a better handle on what the next research questions are. So in a post-market space, as we try and target technologies, target interventions to make sure that patients are getting the preferred outcomes that they want, that their families are seeing the care that they want for their loved ones, that we can better address that. We're also starting to commission emerging technology evidence summaries. So we've got our first one delivering probably in December on the new genetic therapies. So a very hot topic, a very important area where folks really just want to have a better sense of what the evidence is out there, including clinical literature and gray literature. And we're also developing evidence maps to help us identify where it is we should make future investments. And with that, thank you for your patience. Thank you for your humor.